Bulai, Cabinet Secretaries present, Excellency Governors present, Principal Secretaries present, the Controller of Budget, the Chairperson of the Commission on Revenue Allocation, the Office of the Auditor General, the Chairpersons of the Constitution Offices and Independent Commissions, the Office of the Registrar, the Chief Registrar of the Judiciary, Deputy Governors present, the Chairperson CAF, and the CECs for Finance and Planning, and all the protocols observed, ladies and gentlemen, guided by Article 62 and 189 of the Constitution of Kenya 2010, and pursuant to Section 187(2) of the PFM Act 2012. The Intergovernmental Budget and Economic Council is the body established by law to provide a platform for consultation and cooperation between the two levels of government. Your Excellency, the Deputy President, sir, and members of IBEC, I have perused the various provisions of the law relating to convening of this meeting and wish to state that this IBEC meeting convened today, the 13th February 2026, is legally convened and has the requisite quorum as per the Public Finance Management Act 2012, Section 187(1), and therefore the meeting may proceed to conduct its business. With your permission, Your Excellency, kindly allow me to recognize the council members by delegation, and I'll request that when I mention a delegation, you may be upstanding. And I want to begin by the team from the National Treasury. Can you be upstanding? The team from the Office of the Controller of Budget. The team from the State Law Office. The team from the Intergovernmental Relations Technical Committee, IGRTC. The team from the Commission of Revenue Allocation, the State Department of Devolution, the representative from the Parliament, both Senate and the National Assembly, okay. The Council of Governors Secretariat, the CECs for Finance and Planning, the County Assemblies Forum, the delegation from the Minister of Health. We have a big delegation. Then we have a delegation from the Minister of Lands and Planning. And I want to also recognize in an also any other delegation from state agencies that are here. Your Excellency, with your permission, allow me then to request the members of the front table, the council members in the front row, for a self-introduction, and I would want to see if a mic can be passed faster to facilitate that. The front row only, Your Excellency.
Kevich Kirago, Chairman, Intergovernmental Relations Technical Committee.
Sami Chipkwan, Chairman, SRC.
Isaac Nganga, Deputy Auditor General.
Kipkuru Chipkwan, CEO, IGRTC.
Winfrida Mokaya, Chief Registrar, Judiciary.
Mary Modoni, PS Public Health.
Charles Hinga, PS Housing.
Chris Kipto, PS National Treasury.
Alice Wahome, CS Lands, Public Works, Housing and Urban Development.
Aden Duale, CS MOH. Christopher Wanjau, Chief of Staff.
Witi Mary, CEO Council of Governors.
Benjamin Cheboy, Governor Baringo, and the whip the governors.
Your Excellency Ken Lusaka, Governor Bungoma, Senate Speaker Emeritus.
Mutahi Kaiga, Governor Nyeri.
FCPA Fernandez Baraza, Governor Kakamega, and Chair Finance UG.
Stephen Munania, County Deputy Governor Muranga.
Mahat Aliloka, Deputy Governor, Tana River County.
Your Excellency, David Cornez, Deputy Governor, Nakuru County.
Thank you. I think, Your Excellency, at your opportune time, you'll introduce the members of the high table at your time. Your Excellency, it's my humble pleasure to invite the Chief of Staff, Christopher Wanjau, to come to the podium and to invite you, Your Excellency. Thank you.
Your Excellency, the Deputy President, Professor Kindiki, the Chairperson, Council of Governors, Honorable FCPA Ahmed Abdullahi, Cabinet Secretaries present, Excellency Governors, Principal Secretaries present, and all protocols observed. It is my humble pleasure to welcome you to the 29th Ordinary Session of IBEC that brings together the two levels of governments and draw participants from the three arms of government. Ladies and gentlemen, the folders and files in front have reports, documents arranged according to the agenda. In addition, you are provided with QR code and the link provides soft copies of the reports and documents. It's now my pleasure and humble duty to welcome His Excellency the Deputy President, Professor Kindiki, to make opening remarks and conduct the meeting. Welcome, Your Excellency.
Good morning. I think before we start the meeting, I'll ask the Chair of Council of Governors if they have anything to say, and then we go straight to the substantive agenda of today. Mine is to thank you and welcome you to this meeting, the 29th Ordinary Session of IBEC. Secondly, to note progress that we've made since the last meeting. I think in the past we have had issues around the rate at which decisions of IBEC are implemented. We've seen some progress. It's not enough. We need to do more, because this is a very high-level meeting with very high-level officials from the three arms of government, from the two levels of government, and therefore there is no reason whatsoever why we should make decisions which take forever to be implemented. We have cabinet secretaries present, heads of independent institutions and commissions, and all of us are here. The COG is here. So I see no reason why we should not even do better. Secondly, as I have provided guidance before, this is a policy making organ of devolution. It's not a technical meeting. We don't dwell on technical issues because the law provides for how to transact with technical matters at different levels. We have technical groups where everybody is represented. We have sector forums convened at ministerial level. So we will be very brutal with anything that takes us to technical issues. We will be extremely uncooperative because this is not the forum. And for that reason, we intend to take a very short period of time. But having said that, I am grateful for. But we've had a sticky issue around access to bursary funds, and I think there is progress made so far. Some counties are accessing the control of budget and the COG for harmonizing that position, and whoever is not getting access is just because of procedural issues, mainly from their side. We have had other issues also which we have resolved. I don't want to recount all of them. I just want us to encourage to have a better positions. I also want to note that between September, when we had the 28th IBEC session, and now, in between we have had a pre-summit meeting, very trim down the agenda that would have gone to the summit. Although eventually some of it found its way there, I will make sure in the next...
I want to thank you for your stewardship of IBEC, and I agree with you that we need to better track how we actually implement the decisions of both IBEC and Summit. I thank you all.
Thank you very much, Chairperson, Council of Governors. I think the other colleagues on the table here, you know them, but if anybody doesn't know anybody here, when they'll be talking, they'll introduce themselves so that we save time. But I think these are well-known senior public servants. On the matter of drought, I agree with you, we need better coordination. I think we directed that the county steering committees that were overseeing this be reactivated in every county, the governor, the county commissioner, and all the stakeholders, including non-governmental actors like the Red Cross in every county, those who are present in that county to oversee that. So I think we can have, if you have 10 minutes after this meeting, you can have a discussion, and somebody from the office get me the CS for special programs and the PS to come and see us at 10 o'clock. Then you can maybe come with another member of the COG, and then we make some track 2 short meeting on the drought situation, which is a very serious challenge we are facing, but we are doing everything possible to make sure that we don't lose human life, and also that we don't lose livelihoods in terms of livestock. I think between November, when the drought started, Treasury has been very supportive to this cause. I think in September there was some 3 billion or thereabout, 3.5. In December, 2.5 billion. Last month, January, 3.5 billion, and this month, 4 billion is expected from this week. So we are making good progress. We have also secured animal feeds, which was a challenge. We had procurement-related problems, but we sorted out last week. And from, I think, this morning, hay and animal feed will reach the farthest point, which is Mandera, and then we start distributing coming back to Nairobi. But I think the lorries left yesterday morning, no, the day before yesterday night. So they should have reached Mandera this morning. So we are working hard on that front, and I agree with you. Any animal feed which is locally available in the counties, I have already directed the Ministry of Special Programs to first see whether we can offtake that, procure that, buy from the farmers there before transporting animal feed generally. Let's look at the minutes, good people. Page 1, 2, and 3. Minutes of the 28th ordinary session of IBEC. Page 1, 2, and 3 are attendances. Just make sure that the attendances are okay. Page 4, attendances also. Page 5. I think these were circulated. That's what I'm informed. Page 6, they were circulated in advance. Page 7. Page 8. Page 9. Page 10, page 11, page 12, 13, 14, 15, 16, and 17. proposer. Proposer, Governor Cheboy, seconder. Those who are present, any seconder? Oh, Senator retired Emeritus Governor Lusaka. PS retired Emeritus Lusaka. Thank you. Very good. There are two matters arising. One of it is on health. SHA, CS Duale, you have the floor. Try and summarize so that we have an interaction, and we have maximum 20 minutes on this agenda, all inclusive. 20 minutes of this agenda, including the plenary and questions and everything else.
Thank you, Your Excellency, the Deputy President and the Chair of IBEC, the Chair of the Council of Governors, Your Excellency, Chairperson and Council of the Council of Governors, fellow Cabinet colleagues, Principal Secretaries, independent commissions. Your Excellency, I'm honored to present to IBEC the status of our transition to Social Health Authority and our progress towards universal health coverage. As we convene here today, our mission remains to deliver Bima Bora Afya Nyumbani for every Kenyan. And I'm pleased to report that Taifa Care Initiative has gained enough immense traction. Between October of 2024 and 11th February 2026, we have registered 29.4 million Kenyans. Financially, the fund is robust. We have collected a total of 142 billion across all the funds. Critically, for the counties represented here, we have disbursed 102.3 billion to healthcare providers in order to ensure service continuity. Access to service is expanding daily, Your Excellency. 8.08 million Kenyans have utilized the primary health care fund, while another 3.2 million Kenyans have accessed the specialized care under the Social Health Insurance Fund. Excellencies, a primary concern for this council is the liquidity of county facilities, and the data that I have presented confirms that funds are effectively moving to our grassroots facilities. Under the primary healthcare fund, for example, we have paid 13.3 billion, with 57% of that going directly to our county public health facilities. And I wish to specifically commend the top performing counties that have maximized the utilization of these funds. Nairobi leads with a pack, having received 1.34 billion. Kiambu follows with 754 million. Mombasa has received 597 million. Kakamega and Bungoma round up the top 5, receiving 556 and 455 million respectively. Under the Social Health Insurance Fund, where we have paid out over 84.6 billion, the leaders are Nakuru with 1.4 billion, Homa Bay with 1.29 billion, and this demonstrates the facilities which get their documentations right are seeing significant revenue. A critical pillar of UHC, Excellencies, is to ensure no one is left behind. And we have seen exemplary leadership from our counties stepping up to sponsor their vulnerable households. And I want to officially recognize, Your Excellency, the Deputy President, that counties that have paid their pledges and are actively supporting the most vulnerable people among our communities are Murang'a County, that paid 171 million, covering over 107 households. Trans Nzoia County, 23 million for 2,178 households. Migori County paid 5.6 million for 4,800 households. Mombasa County paid 3.6 million for 1,045 households. We also want to acknowledge the pledges that we have currently have, which are under validation from Kisumu County, Baringo, Nandi, Lamu, and Uasin Gishu. And I urge these counties to expedite the payments so that their indigents or their vulnerable residents can start accessing the benefits immediately. Your Excellency, we are steadfast in our commitment to maternal health. Since October 2024, the Social Health Authority has facilitated 583,298 normal deliveries and 326,684 cesarean section across the country. To ensure that we fully support the grassroots, we have identified a specific need for level 2 and 3 government and faith-based facilities. And as per the direction of the summit chaired by the President, we estimated a budget requirement of 2.04 billion to effectively kickstart and sustain free maternity service at these levels. We have already engaged the National Treasury to seek this specific allocation, ensuring that our dispensaries and health centers in far-flung areas are not left behind, and our mothers and women will not walk long distance looking for a facility where they can deliver. And the National Treasury has confirmed to us that they will put it in the supplementary. Simultaneously, we are addressing the unique needs of young mothers through the Teenage Mothers Program. We have registered 48,273 teenage mothers nationally. The counties leading in this charge are Bungoma with 4,037 registration, Kakamega with 2,950, Meru with 2,807, and Kisii with 2,532. On the Public Officers Medical Scheme Fund, I am pleased to report that the scheme has grown significantly. We have successfully onboarded all civil servants under the Public Service Commission, and effective 1st of December 2025, all the teachers, 415,000 teachers in our country, are now served under the Social Health Authority. I call upon all our county governments, Your Excellency, to follow the example of Vihiga and Nairobi counties by onboarding your employees onto the Public Officers Medical Service Scheme Fund. This will not only cover your staff, but also will boost our revenue streams of your county facilities where they will seek medical care. On infrastructure, Your Excellency, through the National Equipment Service Program, we have installed equipment worth 6.18 billion in 126 facilities across the country. Today you go to Lamu, King Fahd, one of the far-flung counties, you will find a CT scan, you'll find a complete theater, and you'll find a pediatric wing with oxygen that reduces the travel for Kenya to go and seek referral facilities or referral treatment in our level 6. I urge governors to sign the next addendums in order for us to operationalize the funds for maintaining these equipments. Finally, regarding the implementation challenges, Your Excellency, we have deployed county clinics, joint teams from MOH and SHA and DHA are visiting counties to resolve claims and system issues on the ground. So far, we have visited Kisii, Kisumu, Mombasa, Mandera, Embu, and Makwiny. And this goes also for the faith-based and the private hospitals, so that any issues on how to lodge your claim, on how to deal with our digital superhighway, these clinics will help us resolve. And I want to single out Kenyatta National Hospital, Nakuru Nakuru Referral Hospital as one of the, and Mombasa as one of the counties and referral hospitals that have done extremely well in making sure that their claim system is right and there are no rejections. Your Excellency, to conclude, I place the following urgent request before this council. Number one, correct bank details. I urge the governors or governors to instruct their county health CECs for finance, both health and finance, to provide us with accurate, verifiable details for over 1,287 health facilities immediately. We want to clear these payments by the end of this month. These facilities, mainly in our counties, over 1,000, we cannot pay them. We have their money because we can't pay them because of the details that they have provided are not correct when we check with the bank. So we really want that immediately resolved through the chair of the Council of Governors and the Secretariat. Two, we really want the county government to sign the National Equipment Support Program addendums, and I urge governors to facilitate the signing of these addendums for facilities where equipment is installed. This will unlock the flow of funds for equipment maintenance. Third, we urge the council to fully implement the Facility Improvement Act. Revenue retained by facilities must be treated as an addition to, not to a replacement for the equitable share in the health sector. And fourth and last, we want counties to support us in the programs for helping the indigents in our country. We request more counties to follow the example of Murang'a and Mombasa in identifying and paying premiums for the indigents to ensure that no one is left behind. With your support in resolving these administrative and compliance hurdles, we will deliver a healthcare system that is accessible, affordable, and dignified for our people. Your Excellency, that is a brief. The document presentation is available. We will give it to the Council of Governors. We have county by county what we have paid, what is outstanding, what they're supposed to do, and we can share that with the Secretariat. But this is just a brief of our presentation. I really also want to thank the 10 counties in terms of registration. The county of Mombasa, Nyeri, Bomet, Elgeyo Marakwet, Kirinyaga, Tharaka Nithi, name it, the 10 top, who are now at an average of between 65 to 71. I really want to thank them because they're counties that are doing very well, and I really urge the ones which are at the bottom to make sure that they catch up with their colleagues. Thank you very much, Your Excellency.
Thank you, Waziri. A round of applause for CS Duale. Thank you very much for that very clear presentation. We now want to find out what the feedback is from the plenary. That's what Waziri Duale has said. Chairman Abdullahi.
Yeah, Your Excellency, I want to present a short report here in rejoinder on behalf of Governor Abdul Samad Sharif Nasir, who is our Chair of Health and who, because of other exigencies, could not be here. We take note of everything that the CS has said and presented. Excellency, SHA has been operational since October 2024, and we reiterate the county government's commitment, which has really been consistent in support of SHA, in change management adaptations, and in championing registration and aligning to the new health information systems across facilities. However, there still persists certain challenges which we have previously raised. We appreciate the position that this is not a technical working group discussion, but we just want to highlight from the Council's perspective what these challenges continue to be. Number one, unpredictable payment of PHC and SHIF funds. Though there was a commitment to pay by the 14th of every month, it's not happening, and especially for PHC, some of the counties have not received their funding from us. I think the last being September in some case or October in others. So we'd want SHA to provide a predictable payment schedule for unpaid claims directly to counties, so that there's some predictability into this arrangement. Notwithstanding the issue of account details and other paperwork issues, the issue of rejection of legitimate claims being flagged over as fraud persists. Maternity services are no longer free. It's more fragments, access is restrictive, limiting care, and its affordability, and this will probably be taken in line together with the issue that we raised in summit, which he promised to intervene on through the PHC funds, of paying for deliveries at the level 2 and level 3. There are also system and network failures that affect service provision and claim processing, especially in places where internet is weak. So in our meeting on this matter, and we've been engaging with the ministry, we have come up with the following resolutions. With respect to cash flowing facilities, that SHA must demonstrate settlement performance for claims on services rendered, including reconciled remittances and predictable payment timelines. 2, payment schedule and arrears roadmap. SHA to issue a dated payment plan showing when outstanding arrears will be settled, county by county and facility by facility. 3, correction of misrouted payments. We're asking for immediate verification, correction of funds paid to the wrong facilities with written confirmation to counties, particularly in Kilifi, Turkana, Meru, and Kitui, that have actually raised those issues. On digital and claims system fixes, this is counties that have actually reported system failures. The Council recommends that DHA and SHA prioritize addressing all system issues, because SHA is very much system dependent. On maternity claim verification, there is need for urgent implementation of summit resolutions on reimbursements for maternity services at level 2 hospitals, including allowing mothers without IDs and teenage mothers without documentation from guidance access to care. Maternity should indeed be free for every mother. Last but not least, we are seeking targeted accountability instead of blanket sanctions. There should be written communication with justification prior to suspension or blacklisting of public health facilities from SHA. Your Excellency, that ends the official rejoinder as per the report from the Council's Committee of Health, but that doesn't preclude other governors who are here from making their input. I thank you.
Thank you very much, Chairperson COG. Before Minister Duale maybe response to some of those issues. So it's not clear from me, listening to both CS Duale and Chairman Abdullahi, I am not clear what this IBEC is supposed to do. Because listening to both presentations, there are operational issues. You know, there are issues that are operational in nature, like on the issue of rejection of claims. The minister says, you know, we need to put our documents together properly, and make sure that we don't have challenges with rejections, because it's electronic.